Peace and welcome to the Born Black Birch Publishing channel, where we share insights from books on writing, editing, and publishing, and give updates on projects that we're working on. Currently, we're taking submissions for our literary journal, where poetry, essays, and short stories are welcome if you're interested. The email address to submit is in the video description. Aside from books related to writing, I also read to understand the experiences of others and the issues that affect them. So I recently came across Visible Women, Data Bias in a World Designed for Men, which covers the consequences of the gender data gap, or how the lack of data collected on or about women often affects women negatively and severely. Author is Caroline Criado-Perez. She's a writer, broadcaster, and feminist activist out of London. So you might wonder, how might the lack of data collected about women impact women in simple, everyday sort of ways, and how bad can the consequences get? A claim that she makes is that the gender gap is a cause and consequence of the type of unthinking that conceives of humanity as most exclusively male. So that might result in things perceived to be minor, like struggling to reach a top shelf that set a male height norm, or it could be having a heart attack go undiagnosed because your symptoms are deemed atypical. That's the effect of what she calls the phenomena of the default male. In the intro, she describes how the default male perspective is shaped and how it persists globally. She cited a 2015 report from the Global Media Monitoring Project that found that women only make up about 24% of people heard, read about, or seen in newspapers, magazines, TV, radio, news. And when you consider globally, women actually outnumber men by a percentage or two. So to have only 24% of the news even discuss women or show women, what message is that saying to women about their impact on the world or their importance to the world? The book is written in 6 parts, each one representing a different space where the gender data gap ends up harming women when visiting a doctor or at work or as a consumer of products or as a pedestrian, a driver, a lot of different places. And much of the research done originates from outside of the States, but the conclusions they lead to coincide with similar conclusions made from studies in the U.S. And that's basically that the world at large is designed for and made by men. So in the first chapter, she tells the story of town officials in Sweden being tasked with executing a gender equality initiative. So they had to analyze how snow clearing affected different types of commuters and in what ways. What they quickly were reminded of was that women generally walk and take public transport far more than men, and for far more reasons than just their day job, like elder care or child care. The original policy required that main streets and roads were cleared first, and they received the highest priority, then pedestrian sidewalks and bike paths. So these paths women had to take to make sure that their day run smoothly was further complicated by a lack of consideration for pedestrians generally. But when women are the majority of regular pedestrians in the city, the lack of consideration for pedestrians becomes a lack of consideration for women without having to say that the policy is anti-woman. So the councils of the town put together a schedule that and route that prioritized pedestrians, taking care of the sidewalks, side streets, bike paths, and bus routes, and that resulted in a drop in the number of hospitalizations from pedestrians slipping on ice during the winter months. That's just one result of it. Most of those pedestrians who were hurt were women, often resulting in broken bones and severe bruises. And if you're hurt, you can't work, which takes away from your pockets and can also create a logjam in your home life because of the role the women often play in their family, but also in the local economy too, and everything else that capitalists need consumers for. So it was proven to be financially backwards for a city to ignore women. But according to a study from McKinsey, women's unpaid care labor contributes $10 trillion to the global annual GDP. So it's not as if the work disproportionately done by women isn't being counted, it just isn't being paid. Considering that kind of donation or extraction, whichever way you want to think about it, you'd think that city planners and other logistical, policy-oriented minds wouldn't mind catering a bit more to women. But even in our modern, supposedly socially progressive era, a company like Apple still missed the mark when serving customers who drive and popularize their business the most, that being women. In 2014, when Apple rolled out their health data tracking systems to keep track of your blood alcohol level, your blood pressure, and of course your daily steps. It didn't include a period tracker in its first iteration, causing somewhat of a backlash or a stir. But this is the kind of oversight or lapse in judgment that can occur when you construct a team that doesn't include or just doesn't think about women. So it can even happen to a company like Apple. But it's not just health-centered products for tech companies, it's the medical industry too. Heart disease largely appears to be a male thing, but an analysis of data from 22 million people from multiple countries, the US, Canada, Asia, Europe, found that women from lower socioeconomic backgrounds are 25% more likely to suffer a heart attack than men in the same income bracket. And while men experience heart attacks more often, women die from heart attacks at a far higher rate than men, which you would think will warrant some attention, like more funding for proper training, research, or prevention. But she also writes that a major contributor to women dying from heart attack is misdiagnosis. And in a study done in the UK, she found that over 50% of women were misdiagnosed, not just because of atypical physical presentation of a heart attack, but because it also presents chemically different too. So there's a protein that's released in the blood after a heart attack called tropopin. I'm not sure how to pronounce that, but cardiologists measure that to determine if what you experienced was a heart attack. And women's average reading for tropopin after a heart attack was likely to fall beneath the threshold to call it a heart attack. And that's thanks to the default male bias, what the standard is based on. So women get a little aspirin, some antacid, and get sent home. But if research and training around all diseases considered gendered outside of obvious ones like the reproductive ones and breast cancer, for instance, maybe the medical field could save more lives, more women's lives. In a chapter called "The Myth of Meritocracy," she cites dozens of studies about the veneer of equitable treatment that has long shielded employers from accountability and from a lot of different directions. Even though women have been earning college degrees at a higher rate than men in recent decades, the employment and career advancement prospects for women still have a lot of barriers to overcome before we can say that job opportunities are equal regardless of gender. And yet, the Western world wants to promote the idea that we have the privilege of enjoying this meritocracy, where you can get anywhere from anywhere, reach any goal from any starting point, and without being impeded by any external institutional forces. Meritocracy at this point is really an ideal or a North Star to strive toward, much less of a reality. But most ways to build a true meritocracy are straightforward fixes. An example that she gives in the book is the New York Philharmonic Orchestra. Outside of a few women in the 1950s and 60s, there were no women musicians in their orchestra. But the lawsuit that was filed in the 1970s, the orchestra started holding blind auditions and immediately saw an increase in the women musicians that has stayed consistent. And now women currently sit at about 50% of the musicians in the orchestra. But blind interviews and auditions aren't practical in every situation. Like in performance reviews at work, once you get in, your work is supposed to speak for itself at review time, and then your value will be undeniable. So a promotion or salary jump is just a matter of time, right? But unfortunately, performance reviews just happen to be another instrument that U.S. companies have employed to sort of cosplay equality without actually doing anything of substance. So in 1971, about 45% of businesses used performance evaluations. And by 2002, it was 95%, which is good, but everything that looks good isn't always good. When you sort of dig beneath the surface, you can find some rot usually. And an analysis of about 250 companies in the tech fields revealed that women received the overwhelming majority of criticism based on personality. These are fields that are supposed to be inherently merit-based because it's all about results and functionality. But words like bossy, abrasive, irrational, and aggressive only showed up in women's reviews. The only time aggressive showed up in men's reviews was when they were being encouraged to be even more aggressive in their career aspirations. So it's no wonder that 40% of women leave tech after 10 years as opposed to 17% of men. And the reasons that they listed were things like feeling stagnant in their career, workplace conditions, undermining behavior from their managers. So it wasn't out of a lack of appreciation for the position or the field itself. So I mentioned a little bit earlier how heart attacks differ in men and women and how the medical field had inadequate responses because that difference wasn't those differences weren't accounted for. You want to believe that misdiagnosis isn't intentional on the part of doctors or other medical professionals, but you only have to look as far as medical school to see how risks to women's health is sort of baked into how doctors are trained and educated. A review of MIT's online database for medical school courses found that 9 out of the 95 schools included in the database offer a course that could be described as a women's course, and only 2 of them were mandatory courses, which is obstetrics and gynecology. You know, when there's a gap in training, there's bound to be a gap in diagnosis and treatment. That's just common sense, but that's what happens when it's assumed that there are no significant differences between sexes. Simply including more courses might seem like an easy fix, but because of the default male bias, there hasn't been enough sex-specific data from medical research on women, so there aren't enough textbooks to easily close that gap. Using an example of autoimmune diseases, about 8% of the population is affected by them, with women 3 times more likely to develop one. You would think that training on autoimmune disease would be informed by a default female bias, considering those kind of numbers, but apparently change is slow. This book is definitely ammunition for the argument what you don't know will hurt you, and a reminder that despite seeming to live in a super advanced modern world that addresses the most basic human needs through these powerful institutions we've built, we have a long way to go. The fact that so much research and reporting is from the 2000s and 2010s is actually quite disturbing, considering the capability to solve most, if not all, of the issues that are laid out from these findings. If you want to get a data-supported picture of the distance that we have to travel to get to a better place, this is a pretty good place to start. If you enjoyed this video, hit like and subscribe to the channel for more on writing, editing, publishing, and occasionally some reads from my personal collection. Thanks for watching. Peace.